Okay, so we'll start with migraine. Migraine is basically headache with associated symptoms. Associated symptoms would have an aura, maybe in the classical migraine, and phonophobia in case of like tinnitus, and nausea, vomiting is there. Migraine headache is basically unilateral, a throbbing headache, and if you will see ahead in this part, suppose a unilateral headache is there, the patient complains of that whole head is like and one side it is so severe that they want to like uh, bang their head on the wall, so it's so irritating, right? So this migraine headache is usually can be there in any part of the life, but basically they have early onset, but yes, there were uh, uh, it has a trigger, it has always a trigger. Suppose even a pregnancy can be a trigger also, and many some stress can be trigger also, some exams or something like that. There will be many triggers, and it may occur at any age of, I've said, after 40 also there were many patients like with migraine coming, right? So you have to understand there is difference between acute attack and chronic attack. So in chronic attack we basically give the prophylaxis. In acute attack there are mild headaches, we give NSAIDs, normal NSAIDs जो भी even we give in the pregnancy if there is a migraine attack we give NSAIDs because it is safe. But the problem is that yes, we give paracetamol, aspirin, valproxen and brufen. The thing is that sometimes it is moderate to severe, it has a very high severity, right? So we give 5-HT serotonin, 1B 1D agonists, these are the triptans or the ergots. The ergots are non-specific, so ergotamine and dihydroxyergotamine we use, okay? So basically these are what? These are ergots. And triptans, drug of choice, overall drug of choice, triptans we use. And in triptans we use sumatriptan, that is the most commonly used oral, IV, rectal and nasal. Even sumatriptan is there. Zolmitriptan, yes, nasal route is there. Rizatriptan is the most effective. Frovatriptan is the longest. Alitriptan and naratriptan is the best oral, and bioavailability is present. So these are the triptans which are used in the migraine. Now in the moderate to severe migraine, to be more specific, right? What is the mechanism of action? These are vasoconstrictors. And it decreases the release of inflammatory mediators. These are decrease the release of inflammatory mediators. So at the end of the day, what will it do? It will help there in the migraine area. So there will be vasodilation, less blood supply, ischemia. So and also a new concept of CGRP we'll discuss later, right? What are the side effects of triptans? Hypertension can be caused and vasospastic angina can be caused. These are contraindicated in heart disease patient, and triptans with ergots are never combined because of the same side effect. D2 receptor antagonist decreases the aura and nausea, vomiting. Domperidone, metoclopramide and antipsychotics are basically the D2 receptor blockers. We have discussed about domperidone, metoclopramide also. It has 3 actions basically. Anticholinergic we have discussed, and right, and not anticholinergic, sorry, metoclopramide has other properties we have discussed before also. Okay, so 5-HT3 antagonist and 5-HT4 agonist we have discussed, and D2 receptor blocker. These are D2 receptor blocker, chlorpromazine also. Opioids, IV pethidine is used, and intranasal butorphanol is also used in the migraine. Okay, prophylaxis, beta blocker, propranolol is the drug of choice. Timolol sometimes used, not so important. Propranolol is the drug of choice. Anti-epileptics for are valproic acid, topiramate and gabapentin. Okay, and monoclonal antibodies decrease the CGRP, the new concept of CGRP in the migraine, so you should know about that. And erenumab, malanuzumab or galcanezumab, right? These all 3 are used. That is EFG, and I believe that you just don't mug up these monoclonal antibodies. You just remember the name of the disease and add the monoclonal antibody point by point, right? Now the tricyclic antidepressants are amitriptyline and nortriptyline. In the CCB there is fluvarizine, and in the anti-serotonin this is methotrexate, getaserzide, and cyproheptadine. Methotrexate are banned because of retroperitoneal fibrosis. So these were all about your migraine.